Welcome back. Well, it's been over 2 years since COVID-19 impacted the world. For some people, the virus exposed underlying conditions and caused minor as well as major strokes. In fact, more than 6 million people have died from COVID-19 related deaths globally, and nearly 680 million have been affected. So to speak to us about the role of diet, exercise, the differences between heart attacks and strokes, and also the impact that COVID-19 has had on one's body and one's heart, so to say. Please welcome Dr. David Jankelow, who joins us now. Dr. David, thank you so much for your time this morning. I mean, it certainly has been one of the most contentious 2 years in any human being's life. And bringing up certain health conditions and making us understand that actually our bodies are very vulnerable. If we don't take care of our bodies, they will have some severe impacts like heart disease and strokes and the like. Just share to us and just paint us a picture in terms of how we've been faring so far in terms of just looking after our hearts, our bodies during this 2 years.
So it's been a whirlwind. First of all, thank you very much for having me, and good morning to you and Rapiwa and to all your viewers. It's been a whirlwind the last 2.5 years. I've worked in a physician team at the hospital where I work at the Linksfield Park Medical Center. We divided into teams of physicians, and each team has 1 or 2 cardiologists with them. So it has really been an unbelievable time. And in 38 years of being a doctor, I never thought I would witness what I actually did. Just in terms of your interview just now, COVID seemed to bring out the best and the worst of people. And in terms of medicine, it seemed to bring medical teams together, that everybody was watching each other's backs and everybody was supporting each other, and really teams came together to work cohesively like never before. So that's just one point that I'd like to make. I don't want to fearmonger. The vast majority of people who get COVID will not get heart and stroke complications, but it is possible. But in terms of lifestyle is a significant kind of impeder or prevention of these diseases. So I think that it's important for the population to observe a healthy diet. We, as the South African Heart Association, endorse the Mediterranean diet that is rich in olive oil, mixed nuts, fruit, vegetables, lean protein, everything that they have in on the Mediterranean. That's the one diet that really does reduce events. It's stopping smoking, reducing alcohol, and exercise. Exercise is critically important. The World Health Organization recommends that we should do 150 minutes of light to moderate intensity exercise. That's 30 minutes 5 times a week. But that could just be a walk. And that in itself can have a significant impact in preventing cardiovascular events and complications.
Yeah.
There's evidence in Africa that at least 50% of us are not adhering to those guidelines. And if we actually did, a significant proportion of cardiac events would be avoided. So just a simple walk a few times a week can actually be a preventative mechanism. But it's not the only thing. It's, as I said to you, it's important. When we assess patients' risk, there's modifiable and non-modifiable risk factors. And the non-modifiable risk factors are genetic. It's population-based and also family. We worry about people who've got a strong family history of heart attacks, strokes, because they may be genetically at greater risk than the next person. But there's nothing you can do about your genes, but you can modify your reversible risk factors, which is dieting, losing weight, controlling blood pressure, stopping smoking, reducing alcohol, controlling your diabetes, and if you've got high cholesterol, having a proper conversation with your doctor to determine should you be on cholesterol-lowering medications. And lifestyle may have a significant impact. I don't know if that answers your question.
Yeah, it really
absolutely.
does. And you've made us
very aware of how little we take care of ourselves, David.
I was literally jotting down, David, all the things that I haven't done yet as you were speaking. So looks like we're going for a walk after the show.
We absolutely are, Faith. But David, did you find that during the pandemic, people became a lot more aware of themselves and taking care of their health just because of the stresses of the way that the world was changing? Or did you find that more people fell into bad habits and found coping mechanisms in alcohol or other things? What did you find just in your engagements with patients and colleagues there?
Well, initially when the lockdown came into being in March of 2020, none of the doctors had actually any work. All our patients, they didn't want to come for follow-up. They didn't want to come to hospital. So we did find that people had this fear that by going to the hospital for a checkup or to their doctor for a checkup, they had this fear that they were going to possibly contract COVID. And that was a significant factor. At that point in time, I was the president of the South African Heart Association, and I was a co-signatory to a letter to the COVID command because we wanted to bring public awareness that if you have underlying chronic diseases, that you need to go for your checkups. And the one significant factor, and it was a worldwide phenomenon, people weren't presenting with heart attacks and strokes. They were actually dying at home because they were ignoring symptoms at the time and or waiting till it was too late and then coming to hospital, not even appearing. So we were signatory to this letter, and it was released to the public that if you have these underlying diseases, you should consult your doctor. In terms of lifestyle, I'm not quite sure. As you well know, it was very hard to exercise initially. You weren't allowed to go out of your gate. But that obviously all changed. So it's difficult for me to comment about lifestyle and exercise at that point in time. But I think many people found it difficult.
Yeah. You know, David, as you're speaking about the symptoms and how sometimes people left their symptoms way too late before they did anything, won't you just talk us through the difference between the symptoms of, and maybe you can even diagnose it for us, what are the symptoms that one experiences if they're having a heart attack versus the symptoms if they're having a stroke? And these are just telltale signs that you know for a fact that I shouldn't be feeling this way, or my body's changing and I need to be aware of that. So just take us through the symptoms between a heart attack and actually having a stroke.
Okay, heart attack, the heart is a pump, and the heart has its own blood supply. There are three little arteries that supply the muscle with blood and oxygen. It's when you suddenly block a vessel to the heart muscle, that's when one starts to have a heart attack. And time is muscle. So the lesson is anybody with ongoing chest pain that's not going away, particularly if it's severe and it's associated with symptoms like nausea, sweating, you should consult your nearest doctor or emergency department to determine, is this something possibly dangerous? So a heart attack would give chest pain, but there's many causes of chest pain. There's many layers from the skin outwards to the heart inwards, and each one of those layers could have chest pain. And many patients who present with chest pain, they're not having a heart attack or what we term a myocardial infarction. But the lesson is pain that's not going away, that's persisting, you should seek medical advice urgently. In terms of a stroke is caused by interruption of blood supply to the brain. So those patients would present with neurological symptoms, speech difficulty, facial weakness, or typically weakness on one side of the body, arm and or leg, or it could just be arm or leg. And sudden onset neurological symptoms, one should seek advice and consult your nearest casualty or emergency department to determine what is this due to. I don't know if that puts it in perspective for you.
It absolutely does, David. But what about resources? Not every single South African in the country can afford to get the best kind of medical health care, particularly when there are heart issues involved and the like. Talk us through the resources that do exist for South Africans that they can access to make sure that not only are they having a healthy diet and taking care of themselves, but also that they're able to see a medical practitioner that won't break the bank.
Well, that's a very difficult question because the vast majority of people in this country don't have access to specialist tertiary care. It's very sad. As you know, Charlotte Maxeke Hospital has partially been closed. It's put a huge burden onto Helen Joseph Hospital that was on ENCA the other day. And I think that's an aspect that needs to be taken up by the national government. And the vast majority of people in this country can't go to a private hospital. So, it's difficult for me to comment on. I think that if you are having these symptoms, present to your nearest hospital. And there are emergency departments, Baragwanath, Johannesburg Hospital, I think ED is closed, but Helen Joseph, but that's a significant issue.
Yeah.
Obviously, if you've got medical aid, you can go to a private hospital, but it's a significant problem in this country, which needs to be solved.
Absolutely. There's a whole big inequality that exists, and that is inequality within healthcare in itself, unfortunately. Dr. David Jankelow, thank you so much for your time.